that's now out, and we'll talk about in a little bit. First, I want to recognize our Sergeant Arms, Michael Galloway, John Gilbert, and David Layton. So thank you very much for being here. Appreciate all the help that you've done. For the committee members, you should have a reimbursement form on your desk. Just make sure that you sign that. Unless you want to donate back to the state of North Carolina, you can just leave that blank. We have an agenda this morning. We're going to hear the committee reports. We're going to have a report from staff about an overview of the report. And then we'll have an opportunity for comments from the committee. Just based on timing, we're not going to take any amendments to the report, but we do want to hear your feedback. This is going to be an ongoing process. Once we get done, we will have draft language. We will use the committee structure to implement many of the recommendations. And so this is not the finality of what this group is going to be working on. But I just want to thank the committee for all the work that they've done. I think that for me personally, it's been very educational, and I appreciate the interest of both the committee members and the many advocates and individuals that have participated in this committee. I'm really proud of the work that we've done. So first order of the is we have committee minutes that were sent out, and I will take a motion from Representative Miller to move approval of the committee minutes with the authority for staff to make technical changes and to compile today's minutes. So we have a motion on the floor. Is there a second? Second, Representative Pirtle. Any discussion? Seeing none. All in favor of the approval of the minutes, please signify by saying aye. Aye. Opposed? All right, they are approved. Next up, we're going to turn it over to Jessica, who's going to walk through an overview of the committee report. And so, Ms. Boney, you have the floor.
Thank you, Mr. Chair. Jessica Boney, Legislative Analysis. Committee members, I will briefly walk you through the report. The report contains the committee proceedings from all of the meetings. The findings and recommendations begin on page 31 of the report. And turning to those, the first of which is to use telehealth in jails to complete the first exam. So the committee recommends directing the Sheriff's Association, DHHS, and other stakeholders to explore a funding amount for the provision of telehealth services in all county jails within the state, a model for a telehealth program and its technical components, and an RFP for companies to contract with the Sheriff's Association to provide these telehealth services in the county jails. Next is the use of mobile crisis units to complete the first examination. The committee recommends that the LME MCOs consider and implement ways to use mobile crisis units to enhance the IVC process, including the retention of licensed clinicians as part of the mobile crisis units to provide these first exams. Next is to increase the number of providers who can complete the IVC evaluations. The committee recommends some statutory changes to allow more qualified folks to become certified to perform these first exams. The committee also recommends that NCDHHS evaluate its current training program for commitment examiners and provide additional training that may be necessary for providers who conduct first exams of individuals in jails. Next is to address the staffing and bed shortages in state-operated facilities. The committee recommends that NCDHHS develop a specific plan to increase capacity, and that plan would include a review of staffing models, hiring practices, retention, and incentive pools. Along that same recommendation, the committee also recommends for NCDHHS to explore all possible methods to address these staffing shortages, including a review of staffing requirements mandated by statute, and to identify potential reforms to these staffing models, and consideration of grant opportunities and funding mechanisms to support opening these beds. Next is to improve data collection and provide further study. So the committee recommends enacting legislation requiring NCDHHS, NCDIT, and AOC to study all of the relevant statutes and practices and available technological resources and recommend systematic improvements. The committee recommends that these stakeholders make recommendations specifically to include developing additional training for judicial officers on involuntary commitment, to update the required involuntary commitment examination forms, affidavits, and petitions to ensure the state is collecting the most helpful information for judges to make IVC determinations. They also want to focus on increasing data collection and sharing between DHHS and the judicial branch case management system, and to explore the feasibility of a public-facing dashboard and to allow longitudinal data for additional uses. So the proposed legislation implementing this recommendation is attached as Appendix C. Next, the committee finds that there's a lack of use of outpatient commitment and recommends for the review of relevant state statutes and to identify revisions necessary to align with best practices adopted in other states. Committee also recommends to ensure that there is a payment method and funding in place to support the expansion of outpatient commitment services. Next, the committee would like to provide law enforcement access to BH Scan. The committee recommends requiring DHHS to implement real-time data availability for BH Scan, give law enforcement access to the program, and create the ability to reserve an open bed. Next, we have evaluation of legal standards for involuntary commitment, incapacity to proceed, and guardianship and incompetency. The committee recommends requiring a comprehensive review of the legal standards governing each of those systems and to identify statutory revisions that would then enhance system effectiveness and advance public safety. Next is mental health and the criminal justice system operating as a revolving door. I think this was a problem the committee heard from a lot of stakeholders on. And so the committee recommends directing DHHS to establish a working group with interested stakeholders to address this revolving door problem and then report quarterly back to the General Assembly. Turning to the study the provision of medical and behavioral health care in jails, the committee recommends expanding the NC Safe Keepers program. The committee also recommends surveying how medical and behavioral health care is currently being provided in jails and to examine the details of these arrangements. And lastly, to continue the study of involuntary commitment and public safety, the committee recommends authorizing this committee to continue its work and to reestablish it to continue work for the 2027-2028 biennium. Mr. Chair, this concludes my remarks, and staff is happy to answer any questions.
Thank you very much for that report, and I know and want to thank you and the staff who put in tremendous amount of work for this committee. I will now open it up to any comments from the committee. Representative Torbett.
Thank you. This could be for the chair or for staff, either one. Do you feel like the committee language offers the Department of Health and Human Services and other like agencies dealing with this the ability to make corrections immediately, forthwith, if they see areas where they can help fix the problem based on the outcomes of this committee? Or is all that going to be a legislative change? Or can they go ahead and start implementing some of the things that we were talking about?
I guess I would respond. We've been engaged with the department throughout this process. They have identified a number of things, and I think as we continue to work, things that they can implement without legislative action, I would hope and encourage them to do that. We've had a lot of those conversations. If it needs legislative action, then that we can work on that.
Excellent follow-up, Mr. Chair. Thank you. And if they so choose to make those corrective actions, is there a notification process they can let us know that they are taking that action and hopefully improving upon the situation?
I think that we in this committee and the oversight committees, we're meeting with them regularly, and we can certainly pass that along as they identify and make some changes. We can figure out a way to get that information back to the entirety of the committee.
Thank you so very, very much.
And I'm committed to doing that. And I know that the department has really been engaged with us throughout. So,
thank you.
Yes. Representative Lambeth.
Thank you, Mr. Chairman, and I commend everyone that's been involved in this process. I think it has been excellent, and this report is a very good start. And I think you've emphasized it's ongoing. 2 points. You know, the mental health strategic plan that we worked with the department on last year, 2 years ago, had money funded from the General Assembly to expand and grow the number of beds. We need more beds. And I know it emphasizes here the state-owned hospitals, but there are also some private-owned hospitals, and I'll use the example of Iredale. They are ready. They need some money to renovate, but they're ready to open up beds if they can get a little help from the state. So I would maybe tweak it at some point to encourage others. You know, we eliminated CON for behavioral health beds to try to entice others to build more beds. Maybe tweak this a little bit at some point to encourage private providers to expand, and maybe we evolve into a grants program to help some of these private providers that need some help to get started. Not ongoing funding, but simply started. So that's one point. The second point is, you know, I love performance metrics, and I think this is a great area where if we could, as we're continuing to work forward, that we develop some performance metrics so that we know routinely how we're doing and are we accomplishing the goals we want to accomplish. And I would encourage the group to look at some metrics that we can monitor on an ongoing basis. But again, an excellent report, and I appreciate all the work this committee and staff's done.
Thanks very much.
I can't find it right this minute, but we added some language in here that we may need to keep in mind that is designed to address the issue of non-state or non-governmental providers and beds. So I hope that's a part of this, but I think your point is well taken. And hopefully the longitudinal data and the data collection will also tie into the metrics that you're talking about. So we've got a measure when this committee meets, hopefully again, that somebody can say, we were looking for this to indicate an improvement in how we're handling these cases, and here's the data to tell us.
Representative Liu.
Thank you, Mr. Chair. Really appreciate this comprehensive report. It shows a lot of work that's been done by this committee and our staff members. And I want to make a quick comment about the data collection. And we recognize how important the data collection is that will provide insights for us policymakers. And but I would really love to see not only we will share the data with our state agencies, and we love to see some efforts that perhaps we can make the data available to our researchers so they can publish data and share their insights with us. Thank you.
We'll make sure that we carry that forward. Representative Maury.
Thank you, and I appreciate excellent report. And just to follow up with Representative Torbett, the immediacy of the issues and the problems, I think, were front and center throughout this entire process. And the number one thing seems to be funding. That we have 300 beds aren't being used because we aren't able to staff them. We're not being able to pay the licensed professionals that we need to increase licensing, requirements to get more people able to be licensed. The place of the evaluation seems to be one of the biggest points of contention, getting people out of the ER where they shouldn't be to get these evaluations. And then that second evaluation that, we see the revolving door, that the time expires, a new petition has to be brought up, and people languish, and then they lose that imminent, harm to self or others, and then they're released. So I think there's some real specifics that I hope we could address sooner rather than later, but also as we come up to budgeting, that we get a good sizable chunk of funding that can address some of these problems so they can be taken care of and not waiting until another budget. Thank you.
I think that's well said. And for the staffing of the state facilities, that we have funded positions, and their struggle is finding bodies with which to do it. So I think there's a recognition amongst many of the committee, there's going to be some funding needs. But I think from my perspective, getting the state operated facilities operating at a higher capacity, they have funding. It's just trying to how to make that operational. So, but it's a good point. Thank you. Representative Pirtle.
Thank you for this very detailed report. I guess my question, kind of along with my colleague, with these recommendations, and I think there's some good recommendations, very good recommendations, but with the concern about limiting funding, at some point should we consider prioritizing these recommendations, because some have need much faster attention than others, and so it's just a thought, Mr. Chair. But thank you very much.
Representative Wheatley.
Thank you, and I have enjoyed listening to all the recommendations, and during this process of continued thinking about our community colleges and the asset that they are, that we could maybe partner with them to provide some of the staff training that is needed, just like we have nurses that are not RNs, but, used to call them nurses' aides, but we don't need everybody to be a rocket scientist. We need bodies that understand the need of these individuals. And I hope that we'll look at that and talk with the community colleges.
Representative White.
Just reflecting on the comments that were made about funding, if I'm not mistaken, the state hospitals were one of the facilities that tended across the board to have a lot of extra employment money left over for employees. So since that money was out there, and hopefully some of it is still there, I think that the issue, of course, is getting folks that will come and work in a facility. And I think what Representative Wheatley said is very correct, is that it is great to have the professional at the highest level, but in many times in working in a facility like a facility like the hospitals we're talking about, who house mental health patients, it's people with strong backs and determination and enough education and training to be safe, but not always necessarily at the highest level of expertise in terms of medical field, because as long as there's that person there making sure that the people are safe and clean and fed and taken care of, then we can take the nursing and the medical component in on a regular basis, but they don't have to be housed in the facility. And I think sometimes we forget that.
Representative Cunningham.
Thank you, Mr. Chair. This is a good report. The recommendations are good. I wanted to bring up the issue of, we did an $835 million investment when we drew down the Medicaid dollars that went over for mental health, IDD, and substance use services. And the department has been rolling that out. But I want to say that right now we have no social norms in society. There are none. The mental health crisis has always been here. It's just exacerbated and is requiring significantly more attention. One of the things that I've looked at, I read the whole report, but one of the things that we need to revisit is that we're operating on 1970s, 1980, when President Kennedy decided to deinstitutionalize. And that's been going on for years and years and years. And now we're at a point in society where we may have to look at the disability issues that was done then, because they're not contextual to the time that we're in right now. And what I'm saying is that, yes, we let everybody out and the resources were supposed to be in the community. And it took a long, long time for those resources to get in there. But these individuals with severe mental illness that cannot be managed in society, in normal society, we have to figure out another way to look at those individuals that are not going to self-medicate. They're not going to self-medicate and they also know how the system works because they're in and out of the system, so they learn how to manipulate it. Whether you think their capacity is there or not, they still learn some things in order to bypass the system. So I think we got a lot more to do, and it's a long term. It's not going to be solved overnight. It's going to take a long, long time. Thank you, Mr. Chair.
Thank you. Representative Potts.
Thank you, Mr. Chair. Along with Representative Morey and Representative Pirtle's comments, it's a long way to an end of a bill across the River Jordan into the Senate and down to the governor. So do we have a plan, or do we plan to have a plan that we can take some priorities and narrow it down enough that our brethren in the Senate might see it, that it's a good move? Where do we go from here so we don't just end up with another report on my desk that says draft?
The intention, and we've already started conversations with our colleagues across the way. We have some draft language already started. We're going to be meeting with Senate counterparts to try to, like we've described, what are short, medium, long term? What can we accomplish in the short session? I will be disappointed if we don't have legislation that we can move on a number of things in the short session. So those discussions are ongoing, and that's where I am, and I think Representative Black.
I would just add that from a priority standpoint, we don't need to be waiting on lots of things because we don't think they are as high a priority. There are a lot of stuff that needs to get done, so we need to plan to walk and chew gum at the same time and move several things. If we can't do it in an omnibus bill, then do it separately. But I agree with what Dr. Reeder said, that I think the Senate is interested in these issues, and that we've got some good opportunities. And one of the advantages of continuing the committee is that we can continue to sound the alarm and push these things specifically to the extent we don't get them done in the short session.
And if you want to be on the committee, Representative Potts. Representative Torbett.
Just for time management's sake, do you see the committee getting back together post 26 short session before 27 long session?
That's a great question, Representative Torbett. I don't know. We haven't planned that far ahead.
Okay, thank you very much.
One of our recommendations is continue on through this calendar year, so that at least implies that we'll have time together.
I would add, it may depend on the availability of members in the active season which we are entering.
No, well, and it may happen, with our friends across the River Jordan, what their interest is. All right. Other comments, questions? All right. I'll entertain a motion from Representative Campbell.
Thank you, Mr. Chair. I'll make the motion for approval of the report.
So Representative Campbell moves to approve the committee with authority for staff to incorporate the summary of the final committee proceedings and make any other technical changes. So second, Representative Potts. Any further discussion? All in favor say aye. Aye. All opposed? All right. The motion does carry. This is going to end our time today, and I just really want to thank the members of the committee who have been engaged. We have gotten a lot of feedback, questions from the committee, from the public. We, I think about 700 some public comments, some very short, some very lengthy. And so for anybody who submitted comments, I can assure you that we've reviewed them, we've sent that to the committee, and those comments were incredibly helpful. The feedback that we had from the Department of Health and Human Service, from AOC, from the Sheriff's Association, all of that feedback has been very important, very helpful in our deliberations as we go forward. I also, the staff who has helped us with all of this has been incredible. And so I just want to thank them publicly for the work that they have done and will continue to do. And so, again, this has been a big effort. As we've heard this morning, this is a big issue that has taken decades to get to where we are today. And so we're not going to solve it in the few months that we've had, but we want to continue to make incremental steps forward. Representative Blackwell, do you have any? Okay. Seeing no other business for the committee, I will mention us and we are adjourned.